Hello, do you have low thyroid symptoms, but your doctor says your lab test is normal? Well, let's find out more. Hello, and welcome to another edition of the Ask Dr. Pakel show, where we help people find answers who have chronic health conditions, chronic health issues. And today we want to talk about the thyroid hormones. And if you go to your doctor for your thyroid and you say, hey, I'm having all these low thyroid symptoms, I'm losing my hair, I'm gaining weight, I'm constipated, my skin is having problems, my face looks swollen, I mean, just on and on and on. And then your doctor looks down at your lab test and says, hey, your hormones look normal, I don't know what you're talking about, there's not really a problem here, keep your dosage the same. Bye. All right. Or maybe they'll say, hey, you don't need thyroid hormone. Maybe you've never even been prescribed thyroid hormone. So they're saying, hey, you're fine. You don't need it. Sorry, you have those symptoms. Go to this doctor. So it becomes very frustrating for patients because they're like, hey, I've got all the symptoms of low thyroid. I know I'm taking this. Can you increase the dose? Can you change this? Or can you give me some hormone to help me try to see if I feel better? And again, now you've become a number on a lab test, I hate to say. So it's a very frustrating. So we need to find out why. Why do you feel that way? Yet, you're still at the same dose, or you're not on hormone at all. All right. So let's look at what your doctor's really looking at when they are saying these things to you. So number one, in fact, let me pull this up so you can see it. All right. Number one, they are looking at what's called your TSH number, which is called thyroid stimulating hormone. And if it goes high, then that says, hey, give more medication. If that goes low, take some away. It's as easy as that. It's very frustrating, though, because they're not supposed to do that. You're not supposed to use TSH as a marker to say you need more or less, because there's so many other factors that influence that. So also they'll typically run a free T4, but I would say the majority of diagnoses from doctors come from this TSH number. Now, sometimes they'll look at the T4 number and say, hey, your T4 is really low, let's add some more. And that will depend on what your TSH looks like. So it's very frustrating. If you only look at these two things, you're missing a large part of the picture, which again allows someone to continue to suffer with low thyroid symptoms. So when you get your thyroid labs performed, or if you go to the doctor and say, hey, I'd like to get my thyroid tested, you need to ask them to run some more tests. And sometimes they will, sometimes they won't. But what you also want to see is I don't know where that came from. You want to see your total, I'm just going to write TT3, your total T3 number, your free T3 number. I would say go ahead and get your total T4 number too. And also, you'll probably want to get your thyroid binding globulins tested. It'll look just like that. TBG is what will be on the lab. T3 uptake also gives helpful information. And then I would say on top of that, which you can find this in another video, is your thyroid antibodies. And that's kind of a different topic there that, again, we talk about in a different video. So look on our YouTube page for that, and you can find that video. So here's the thing, though, is if you take T4, if you take your thyroid hormone, your synthetic thyroid hormone, typically T4, basically this T4 has to turn into another hormone called T3. Now that's the active hormone. That's the one that gives you metabolism, energy, helps all those symptoms out. So one of these has to convert to the other. And what happens? How does that occur? How does it jump from one to the other? Well, number one, that occurs in a couple of places in the body. One of the main places that occurs, and the majority occurs, is in the liver. The other place that it mainly occurs is in your gut. So that's very important, which we're going to talk about in a minute. But what actually occurs here is that T4, why is it called 4? What's with the number 4 and the number 3? What's that about? Well, we've got 4 iodine molecules on T4. And on T3, as you would already guess, we only have 3 iodine molecules. So basically, there's this enzyme comes in and chops one of these off. So now we have T3. And that's kind of like T3 is now the actual key that fits the lock on your cells to enter the door, I guess you could say. So very important that this conversion, it's actually called conversion, occurs with this enzyme that comes in and does this. And that enzyme has to have the right environment, the right things to work properly, which we're going to talk about here in a second. But this is very important. And this is why it's important to look at this, because if that T3, if T3 is low, yeah, you're going to have low thyroid symptoms no matter how much hormone you take. So, if this is not being looked at, it's a total problem. So why would it not convert? What would cause this problem in the first place of this hormone not converting from T4 to T3, or that iodine molecule not getting chopped off properly, or maybe some other issues that can influence T4 and T3? So number one, I would say on the list, and you guys may have already guessed this one, is going to be liver inflammation. So if your liver is inflamed, remember I said the liver is the primary area of conversion. So if your liver is inflamed, which could just be called hepatitis, that doesn't mean you have hepatitis type, it doesn't mean that it's viral hepatitis. I mean, the liver can just get inflamed from many things, from our diet, from what we drink, from toxicities in our body. Yeah, you may have viral hepatitis. You may have some other disease or problem affecting the liver. There are many factors or many causes for the liver to get inflamed, or even a genetic issue with what are called your CYP genes that could affect this. So quite a few things, but we want that liver working properly. That liver is a very important detoxifier in the body, but also extremely important for turning this T4 into T3. Okay, the next thing, and you may have already guessed that too, would be gut inflammation. So if your gut's inflamed, that's the second area where this conversion occurs. Lots of things can inflame the gut. I mean, if you're eating a bad diet, if you're eating a lot of junk every day, sugar and simple carbs and things like that, yeah, this is going to create problems right off the bat. But also if you have Crohn's or colitis or celiac disease or IBS or GERD, or just a multitude of digestive issues, yeah, you're already put yourself at risk for an underconversion issue there. All right, another thing that can really affect this, and we'll just kind of put this on here too, would be global inflammation. Now, this will affect a little differently, but still can have just as big of an effect on your T3 levels. And what is global inflammation? That means anywhere in my body can be inflamed, or my entire body's inflamed. But the key with this is when we see inflammation is not a cause, it's an effect. So it's finding out what's driving that inflammation. What is causing that condition or issue? Because a doctor may give you a diagnosis of irritable bowel syndrome or hepatitis, which is liver inflammation. That doesn't tell you what's causing it. So again, it's finding out what's the cause. So inflammation, unless you know what's causing it, it doesn't really help you solve the puzzle. And you can take something to maybe lower inflammation, but again, it doesn't help you solve the cause of the problem. All right. So another thing here as a big possibility is serotonin and dopamine are low. So serotonin and dopamine, and I'm not talking about the serotonin and dopamine that are created in your brain, these neurotransmitters manufactured in the brain. This is the serotonin and dopamine that are manufactured more in the gut. And if they are having problems, then this will affect your T4 to T3 conversion. It can also affect your gut motility and motion. Basically, the gut, your intestines, your small. When I say gut, I mean small intestine, large intestine. They are creating these neurotransmitters that help with a lot of their functions. So it's really kind of interesting because these are the same things we create in our brain. They also call the gut the second brain. It's pretty interesting. But again, this could have an influence. And there are many things that can affect the manufacturing of these neurotransmitters, especially if you have deficiencies of certain things that go into the manufacturing. But again, it's looking for what's causing it. All right, let's go on with some others here. Another thing that can occur is if you have elevated cortisol. All right. So cortisol is, of course, made in the adrenal glands. And cortisol is usually made in times of stress or low blood sugar or a lot of inflammation. Cortisol, what it does is it pulls stored blood sugar out of your muscles, out of your liver, to feed your body, feed your brain when you can't eat, like while you're sleeping or certain times where you just need extra. But the problem is well, let's put it this way too. Cortisol also is like your fire department. It helps to get down inflammation. So if your body's chronically inflamed, you're making cortisol at higher levels on a regular basis, which is not good for your adrenal glands because it's going to wear them out. But also cortisol has other negative effects on the body. Yeah, it may be putting out the fire, but at the same time, it can block this conversion of T4 to T3. One problem is doctors may check your cortisol via blood work, and that's a problem because as soon as you see or know a needle's coming at you, cortisol level can rise, adrenaline levels can rise. So that throws off the test. The only accurate way to really look at cortisol levels is with saliva. This is a side note here. So not that I'm getting into that conversation right now, but again, cortisol important because it can block this T4 to T3 conversion. Okay, what's another one here would be elevated testosterone. Oh, if you can read my writing, in men. All right. So if you're a guy and you're taking testosterone maybe for ED, or you're taking testosterone because you're trying to gain some muscle there or body build, I mean, this is a problem that has some negative effects. Also, one of the negative effects of taking testosterone actually can block also this T4 to T3 conversion. And this is a problem with some bodybuilders, is they actually will have this happen and they'll start to take thyroid hormones to try to overcome this. So they, find their way around it. But definitely that can just create more problems. So testosterone in men, another potential here. So in women, a thing that can occur here is a condition called polycystic ovarian syndrome. And there's actually a whole other video on polycystic ovarian syndrome. If you go to our YouTube channel and look for that video, and you'll find out more on what that's about. But what happens in polycystic ovarian syndrome is that blood sugar is up. Estrogen is being converted into testosterone. Again, kind of a similar thing can occur here. And this not only offsets the estrogen progesterone balance, but again, this occurs just in women, but also can cause that conversion of estrogen to testosterone, which is not good. And that's when women, which again, watch that video, but that's when women really start to feel lousy. They're growing hair in the wrong places. Things are not good. All right. And then this last one here, actually, it's not the last one. It's one that we'll see commonly too, is if you're taking, and again, this is women, if you're taking oral contra, oh, wow, I can't even spell here. Let's fix that. Contraceptives. So if you're taking birth control pills, oral contraceptives, yeah, this is a big one. This depletes B vitamins from your body, and this affects the liver, and this will affect this T4 to T3 conversion. So definitely this is a major factor. Now, there's one other factor here too that we'll commonly see, but it doesn't fit into a condition as much. And these are two nutrients that if they're low, can also cause that enzyme to not work properly that converts your T4 to T3. One of them is if you're low in vitamin B6. So if you're low in vitamin B6, you're going to have a problem. Oral contraceptives deplete B6. There's a lot of things that deplete B6. Also, if you're low in selenium, this will also cause an issue here. So those are very important nutrients to have working properly in order for this to work. And usually the thing for B6, the one that needs to be taken, is called P5P, and the one for selenium is called selenomethionine. And these can both be very helpful for those types of issues. And there's actually some more nutrients that can help out too, but these are the main things and the main causes here that can really come into play when you have this T4 to T3 conversion issue. So here's what you need to do. Don't give up. When your doctor is saying, hey, nothing's wrong, you need to find a doctor who's going to look at these things, a doctor who's going to check these blood tests, all of them, and say, hey, wait a second, do we have a T4 to T3 conversion issue? Because if you do, then figure out which one of these issues is the problem. Now, some doctors will try to bypass this, not find out one of these causes. They will actually just say, hey, let's give you some T3 now. Well, yeah, that might help temporarily, but it's not really helping the cause of the problem in the first place. So again, the key is not to really replace the hormone, it's to find out what's causing it not to convert properly. So that's really the main factor at play here. All right. Well, hopefully everybody got some great information out of this, and have a wonderful day and get some help for those thyroid hormones. God bless. I'll talk to you soon.